8:30 here on the East Coast, so we're going to get started tonight. We are bringing you introduction or 1 year update on the Reaching Rural Surgical Seniors program, which many Granges received information on, some did not. So if you have not received information about this, please drop your email in the comments so we can get in touch with you right away on getting that packet out to you. But I'm going to introduce our guests tonight. Well, really our host tonight, Joan Smith, who is the project lead for the Reaching Rural Surgical Seniors program, and Dr. Laurie Ferguson, who is the technical lead for this program. I'm going to turn off my camera so that I can run the share screen whenever they tell me to. And I'm just going to turn it right over to Joan, who's going to take it away for the rest of the night.
Thank you, Phil. Thank you, Grangers and guests who are online tonight. We have a couple of views from you. We can see a few people and the rest of you are hidden in the background. So we really appreciate your joining us. I'm very proud to be the program manager for this effort for the National Grange. And we're so happy to have Dr. Laurie Ferguson with us. She is a founding dean and professor at the Emory and Henry College School of Nursing, which is in Virginia, in the western part of Virginia, western southern side of the Appalachian area, if you're trying to picture where she might be. And I have a copy of her book, which is titled Rural Health Nursing. And if you've been on the website, you'll find some quotes there from her book. And we're so lucky as Grangers to have her be part of our team. Dr. Ferguson has been our technical medical lead for this project. She was wonderful giving us the overview and help in writing the proposal, reviewing that, and then once we won the contract, helping us put this project together. If you watch the videos, you saw many clips of her talking about what we're trying to do. So Dr. Ferguson, if you would like to say hello to our audience.
Well, just good evening, and it's a real pleasure to join you tonight. I have thoroughly enjoyed working on this project. Just a little background, I grew up in farming country in California, and I have lived rural areas really kind of across the nation and very familiar with the National Granges work and really, really proud to have this opportunity. So it's a pleasure to be here tonight.
Thank you, Doctor. So we have some thanks to do up front. One is for Corey, who is the funder of this project for the National Grange when we bid on this. And for Corey, what does that stand for? Patient-Centered Outcomes Research Institute. It's important that patient-centered outcomes. So their goal is to do research. Primarily, as an institute, they research topics of interest to the U.S. government, Department of Health and Education, Human Services, or other projects that might be federally funded. So they do the research, and then their goal is to find organizations that are able to disseminate that information out to the people that would benefit from the research that they have done. So what we said we could do as Grangers across this nation, because we're grassroots, because we're at the local area, and we're seen as a voice for and a voice to rural Americans across this nation. We have about 1,500 Granges across the nation in almost every state. And our newest state, if you haven't heard, the state of Hawaii now has a Grange on the Big Island. That's our newest state to join. We have so that's proud of the Grange to have one way out there. And hopefully you all get to go to a Grange sometime on the Big Island in Hawaii. So Corey, as the funder, was looking for organizations that could disseminate this information. So in order to do that, they gave us the research, and our goal was to develop a methodology to distribute it. And that's where we need your help as Grangers or visitors or who's ever family members, whoever's online today or in the future, to help us disseminate this. Most of us want to stay in our home. We don't want to have to go to a nursing home or to go to live with a family member. We want to stay in our home as long as we can. And there's a lot that we can do ourselves to make that possible. So that's what we've tried to do, is to share with you on our website, through the documents we prepared, the guides that we have put together, how you might be able to do that, stay in your home a little longer, how to prepare your home, how to talk to your family if a crisis comes up, how to advocate for yourself when you go to your doctor or your surgeon. Speak up. They're the expert in their fields, but you're the expert in your body. What do you want? Make sure they know what you want. You have that decision. I want the surgery. I don't want the surgery. I don't want it now. Maybe I'll want it a year from now. So it's that type of thing. I see a question coming in that's asking us, can you give some statistics of how the program, oh, I lost it. Bill? Let me see.
They're asking how many community Granges have reported as of May 2024.
Okay.
How many people have
As
been
of-
reached?
All right. That's a great question. That person who Joyce or Marty, okay, they're from Montana. So they're asking, how much dissemination have we done so far? We asked all you Grangers, as you were sharing this information, to provide us a report in May, in October of 24, and then in May of 25. I have received 11 fully filled out written reports. I received 5 that say these are our plans for the future. We have 11 that have sent us information of what they're planning on doing. They've opened the doors with other organizations. They've printed brochures. So that's our statistics so far for May. But you have to report by October, and we're going to give you some money, Grangers, if you give us a report, and we'll talk about that just a little bit later. But what I want to do is talk about why the Grange is an organization that Corey felt could do this work. And why do we care? Why is this a hot topic for rural America? So that's a perfect question for Dr. Ferguson to share with you all, why we should even care about senior surgical or senior doctor care and health. Dr. Ferguson?
So I think there's more and more recognition nationally about the real need of rural America to be addressed, that access to health care, access to high quality care, getting the information out is really important. And there's lots of organizations like PCORI who are starting to put some money where their mouth is and funding these kinds of initiatives. Because keeping people healthy is cheaper than paying for what I call the fix-it shop, the hospital or the acute care setting. And certainly from an ethical and moral and just even personal preference, most of us want to stay healthy and out of hospitals wherever possible. And if we have to have a procedures done, knowing before we go in what all the choices and the options are. So kudos to PCORI for really funding this initiative, but it's really a wonderful grassroots to get the word out to population that feeds us, right? So the breadbasket of America, but keeping that healthy. So
Thank you, Doctor. And that's a great lead in to what we call our 2-minute trailer. It's our 2-minute promotional video. For those of you that haven't seen it, this is on the website. It's also on the stick, this little USB drive that we provided to the Granges. They were mailed out to every Grange in the country that we have an address for, that has all the material on it. And if you're the person that's in charge of this at your Grange, we'll put up in the chat the address the email to make sure you can ask me for it, and I'll send it to you. I just need your email, your hard mail address. This would be hard mail, and I'll send it to you. We still have some left. Be glad to do that if you're going to use it to share and disseminate this information. So Phil, let's roll that 2-minute promotional video on this program, Reaching Rural Surgical Seniors.
For generations, the National Grange has promoted the social and economic needs of American farmers. Granges are practical, resilient people who love the land and the way of life it brings. You're devoted to your families, communities, livestock, and businesses. Granges are often multi-generational, with parents passing down the strengths and benefits of their Grange membership to their children and grandchildren. The Granger way of life embodies the spirit of independence. However, 80% of Grange's 80,000 members are over age 50. The rural lifestyle that many Granges enjoy can make it difficult to access healthcare or social support services. In Reaching Rural Surgical Seniors, we explore the challenges that senior Granges and their families face as they prepare for surgeries. We spoke with younger Granges who are caretakers for their parents, and with older Granges who describe their difficulties with planning for their parents' upcoming surgeries. We interviewed medical experts on how to best navigate an often confusing healthcare system and how to advocate for yourself and your senior loved ones. And we talked to National Grange leaders who understand the problems that all Granges have in accessing healthcare while enjoying their rural lifestyle. All senior Granges, their adult children, families, and caretakers will find a wealth of information to plan their upcoming surgeries and receive the best possible outcomes after surgery. If you're over age 55, chances are very high you'll need surgery as you get older. Reaching Rural Surgical Seniors is your guide to thriving in our challenging healthcare system.
Thank you, Phil. So that's the taste of a 23-minute video that we have that talks of each of the important areas that we felt we needed to share with you all. So what we're going to do today, and you saw Dr. Ferguson in that little clip, and she's got many clips on the unique topics that we talk about. I've been getting a lot of emails from you asking how to utilize the information that we've provided to you in hard copy and on the stick. So we want to walk through a little bit of it and show you what's available to you and how you can use it as leaders in your community. All you need is a computer. So if you have to have the ability to project it, you could do that at your Grange meetings. You don't need to have a computer. You could also do it by talking about prepare by looking at your computer at home. If you're on this line, you have a computer. And then you can start discussions on each one of the topics that we're going to show you in just a moment that's available for you. So you can study it a little bit and then open discussions at your Grange meeting on the topic. A lot of these topics are not always comfortable. You know, like you don't want to think about what happens to me if I end up in a hospital. Do I want to have a ventilator? Have you made that decision? You need to make that decision. And under what circumstances? If do I want to be on a feeding tube? When? Why? For how long? So maybe you've thought about those things. Maybe you know what you want, but have you shared that? Have you talked to others? That's one of the tabs, and Dr. Ferguson has a whole section on how to talk to others. And on the website, it gives you some hints on not only how to talk to your family, your friends, your caregiver, your neighbor, but when might be a good chance to do that. And if you don't know, that might be Thanksgiving. Everybody's together. It's a good time to maybe share some of those things with your family about what it is that you want as an individual as you age and go on. So at this time, we would like to pull up the website and we're going to walk you through it. We're still going to be there and you can ask us questions as we walk through it. And we'll be going back and forth between myself and Dr. Ferguson, and she'll be pointing out really key factors and things that you needed to focus on, not only with your Grange family, but with the community. If we're trying to dismember, our goal as Grangers is to disseminate this information to others, not just your Grange. What about your Elks, your Kiwanis? Print out the guides. There's 2 guides that we're going to talk about. Take them to the senior center and just leave them there. They'll disappear in a day. So disseminate. That's what we need to do. Expose people to the information. This is the front page of our website. And it has that scroller that you see going by, and that's to catch your eye. Now, if we work our way down this front page, do you have questions about surgery? What is the problem? And the next slide down, Dr. Ferguson talked a little bit about what is the problem. You know, rural America, what is the problem that we're trying to address that PCORI wants us to share? And so, Dr. Ferguson, you talked a little bit about the problem that we're trying to address here. Perhaps you could enhance that just a little bit.
Well, I think, I sort of referred to this before, just geographically, rural areas are often underserved with healthcare providers, so they have to commute longer distances to seek healthcare. And so that's a challenge just in itself. And then you add all the stress of an illness or a possible surgery. And so it's just really about having um, information before you need it, hopefully, that you can kind of think through some of those issues when it's not the stressful crisis, to think through how you can maybe navigate the system. And I think I'd also point out that while this project is really addressing rural surgical seniors, the scroll across the top really identifies issues and topics to think about, whether you're facing surgery or you have other medical issues such as falls and preparing your home and all of that. So I think they're worthwhile, even if you're not planning on having any upcoming surgery soon. There's certainly good guides for all of us as we experience birthdays, as I call it. So
That's right. When we were given this project by PCORI, their focus was on sharing their research, which was talking about information to surgery patients. Expand upon that, like preparing yourself for just daily living as you age and have that birthday event, and preparing your home and talking with others. So that's why our website not only stresses the information that our funder, PCORI, wanted us to do, but also information that we feel is so important, that was beyond the effort of PCORI. So the solution was, as PCORI felt, was the Grange, because we are grassroots. We do touch a demographic of folks that are not typically focused on by many organizations or many financial organizations. So how do we do this? If we go on down this page, so you know what you have to resources, we have, as you know, 5 regions within the Grange across this nation: Northeast, our Southeast, Midwest, Great Plains, and the Western region. And we provided a POC for you in your region that you can contact, that helped us review the material that was developed by the IPT. Who was on the IPT? IPT is integrated program team. So we had folks from the National Grange headquarters. Stephanie Wilkins was our IT. She put all this up on the website after it was written. Phil, who made everything beautiful and pretty, who's done the flyers and the guides after they were written. He made them look presentable, so it's something that you are very proud of to hand out to others, as well as the flyers that are going out now. And they've Burton Eller is our project lead for the whole program. And our national president, Betsy Huber, and now Chris are both part of the team, as well as, did I forget, Kevin Campbell is our videographer, and he has a place called Campbell Films in Colorado, and he was fabulous to make all these videos and coach us all on how to look and move around and speak as we made these clips and instructional videos for you all to utilize. And I believe he's online tonight. We also have had Samantha Wilkins. You know her as our former youth and junior director from Texas, who left the National Grange headquarters staff position to go back to Texas to care for her parents who needed help. So she became a caregiver as well as the daughter of them. And so she has very relevant information on caring for her parents. And Stephanie Wilkins took into her home her mother-in-law, and she talks about that in the material. So we tried to make it personal for you with people that you know and have seen for years, and their stories of caring for others. And we had the president of the Colorado State Grange and his wife, Gary Wardell, and they talked about their experience as seniors now and surgery. And all of that is available for you to share with your members, the community, and other organizations in wherever you live. If we go down just a little more, you will see that here, every page on the website, we're on the website now that I sent you out a link to. And there's a public survey. And if you go to the website, it'll take you about 5 minutes to fill this out. It's for our use at the headquarters to collect data on how many people are really using the website and what you think about it. Then at the very bottom is my information where I can call you, I can come to you, I can come to your Grange, I can come to your state, I can do whatever is required to help you work your way through this. And a lot of you have asked that, and that's why we're doing this tonight, to hopefully help you all. Our contracting officer for this whole project was a gal by the name of Olivia Casey that we brought on board. She's a technical expert in contracting, and she helped us write the original proposal, as well as now she monitors us as an independent look at the way we're handling the program to make sure that we're doing what we need to do contractually with PCORI, that we're meeting all of their requirements that we as the National Grange must meet in order to get paid in the end. We are getting paid. The National Grange gets paid for this contract, less all of our expenses. So our goal is to do this as effectively as we can and as efficiently as we can, because that will help the National Grange in the long run. So if we can go up to the header now, so that when you open the website, what you're going to see are all these tabs, the black area with the little words in it. Homepage, which is what we're on right now. Then you have all of these topics that you can use in your Grange, in your community, at your senior center, at your Masons, whatever. Pre-surgery, what does that mean? Post-surgery, preparing your home, hospitalizations, falls, talking to others, advocating, and decision-making. We forget that we have those decisions to make. You can make the decision for your body. little bit on finances that I gave you some websites to look at. Memory loss, and then the last tab is real important for you all. That's the videos and all the material. But before we go there, what we're going to do is let's do Dr. Ferguson, which topic would you like to talk about?
Well, you've kind of touched on it a little bit, but I would be happy to expand on the advocacy decisions, making decisions about what kinds of interventions you want. I think at one of my previous projects, we
Let's go
found
there, Phil.
one of my previous projects, we found that people often feel uncomfortable, or people might feel very comfortable and know what they want, but uncomfortable in talking to their friends and families and close people who would be in the position of sometimes making those decisions. And if you don't have the conversation beforehand, then the family and loved ones often feel guilty and often sign you up for more than you ever really wanted, because they feel like, I don't know what mom wants. I want her to have everything. So having those conversations, even if it's not at Thanksgiving when you're trying to have thanks for the year and enjoy each other, that you have the conversation before you have a crisis, and talking through the kinds of level of care you want is really important.
That's right. So here is where we can bring forward some of those thoughts that the doctor just talked about. What is self-advocacy? And the doctor just explained that. And here's a little clip that we captured from her last summer when she was willing to fly herself to Colorado and spend time there a whole day making these little clips. So this is what you have available for you, Grangers, to utilize. So here's a clip from Dr. Ferguson that you could share at your Grange and with all these other organizations about really self-advocacy. So let's watch that. So you know what
when
you have
you
available.
visit your healthcare provider, sometimes it's easy to be intimidated and kind of daunted by some of the medical terms and all the fast pace. It can be a little overwhelming. It's really important that you feel empowered to advocate for yourself and to articulate what your desires are with your surrogate or your caregiver so they can advocate on your behalf if you cannot articulate.
Okay. And then there's more. You'd find more discussion if we go on down. So now here's narrative. These are narratives that we wrote from many resources, pulling together subtopics under each one of these tabs. How to advocate for yourself in the doctor's office. Why is self-advocacy important? So here's a little clip from Samantha Wilkins on answering some of those questions from her perspective as a Granger now caring for her parents who need the help.
My parents have made it very clear that if it came to a time that they needed to go into an assisted living facility, they needed to make sure that I had them in a facility that had animals and they could play with some dogs still. But there were certain things too of, you better please come check on me, because there's been too many times where we've seen someone that's been put into a facility and not had somebody there to advocate for them. Having family on the outside that's going to advocate for a family member that's in an assisted living facility is huge. Having someone that's going to say, ask about doctor's visits and ask about their healthcare protocols and different things like that. If they see something that's off, being able to speak up for their loved one that may not be able to speak up for themselves. Having those conversations now and early is definitely going to benefit in the long run, so you know what your family's wants and needs are. In May of 2022, my dad had an emergency health scare that landed him in the ICU unit, where we were really unsure if he was going to make it or not. We were scared, absolutely scared to death. And in that time, had to make some very quick decisions when it came to ventilators and life support and what we needed to do. Prior to that, we had some conversation, but not a lot of conversation. So it was very eye-opening for me to be able to say, I need to know in the future what you guys want. Praise God, my dad survived and he is well and he is healthy. But in that time, when he needed to be placed on a ventilator, we discussed our options with the doctors and all of the folks that were the medical team of what could be done. That was a difficult situation, definitely a difficult conversation. It's not one that I was ever hoping to have with my family, but once I did, and once I knew their stance and what they wanted, I feel confident in being able to move forward if we ever have those health concerns.
So there, you've heard from a Granger who experienced exactly what Dr. Ferguson was saying. Didn't know what her folks really wanted. Had to make those decisions on the spur of the moment. You need to have an advocate, someone that will be there to help you when you're dealing with surgeons or a doctor. And you need to share your information with your family, and so they know how to advocate for you if you're unable to at that moment. A car accident, a fall. Yes, doctor.
No, I think that the other thing to really feel comfortable with is to ask for things to be explained. It's often we say things as healthcare professionals, and I'm a nurse practitioner, so I practice in rural areas, and a patient will say, "What does that mean?" And I'll think, "Oh, shoot, I thought I was being clear, but I clearly wasn't." And so explaining it in what we call living room language, in language that people understand, not dumbing it down, not being at all disparaging to somebody's intelligence, but realizing we're not talking about it in a way that's understandable. And so patients have the right to ask for that. And healthcare providers have the responsibility to provide information in a way that it's understood, and that choices about how to navigate the system of healthcare are clearly outlined whenever possible.
That's right. Thank you for expanding upon that, because that is important. And I think if you slowly go down the rest of this page, you'll see these how to be efficient in your self-advocacy. And there's some ideas here. Ask questions, take notes. Now, what have we done to help you take some notes? We provide 2 guides. One, this is called the How Talking with Your Surgeon or Your Doctor. And it gives you some this is already prepared. It's on this disc. Phil will show it to you. We'll show it to you when we go back to the last page. But it gives you some canned questions, things to think about that you can ask the doctor. What will I be able to do that I can't do now if I have that surgery? Thinking yourself, do I really want to do this? Depending upon your age, what the condition is, what they're talking about. Will I have any tubes or drains put in during or after surgery? Will I need to have them at home? Those are questions that we need to have ready to ask the doctor. When you go to the doctor, you wait in the waiting room. Then you go in and you have that awful experience at the scale. And then you move on in. Now you're overweight. And then you go in and they take your blood pressure. And so that's elevated because you just found out you gained 2 pounds. And oh my goodness, then you sit and you wait there. And then the doctor shows up. You're tense already. You're anxious. And you forget everything that you had planned to ask the doctor. You just are overwhelmed with the moment. And you don't have a long time with the doctor. They have another patient in another room. So if you go prepared with some questions written down and a pen, these questions that are in this guide, which is part of what the Grange prepared, and this is what we're asking you to take to your print at the local print shop. It's 1 page, both sides, and put it in the senior center. Take it to your church, put it in the vestibule, let the folks walk away with it. That's dissemination of information. And that's what we need you to do to help share with your neighbors, your friends, your club members, how important it is to think through these things. If we could go down a little more, it talks about take notes, speak up, bring a support person with you. Dr. Ferguson talked about that. Where is that person with you that can think of those things that you forgot when you have that 10 minutes with the doctor because he's explaining, you'll forget to ask a question that you had on your mind. So here is our other doctor that helped us with clips, and she's the Dr. Walker from the Big Island of Hawaii, but we won't talk with her on this, but she's talking mostly about some legal documentation. People always ask, what do I need? An advance directive for healthcare. What does that mean? We try to explain it here. Dr. Walker talks to that. She talks about the power of attorney. So we're bringing in here things that you need to think about if you haven't already. So Dr. Ferguson, from your opinion, what legal documents or things should folks make sure they have ahead of time? Or right now, even if they're not sick, they're just, getting old, what should we be doing?
Even if you're not getting old, I've had an advance directive and a power of attorney for probably 20 years. And I think, think about your power of attorney. Who do you want to make medical decisions for you? That might be a different person than it's going to manage your finances. And I think the whole process of creating and having an advance directive is helpful because it asks questions you might not have even thought about. You mentioned, Joan, about a feeding tube. Do you want a feeding tube? And I think, having the conversation of, is this a situation where I have the potential to be cured and to come back, is a very different scenario than there is no hope for me getting better. It's just about prolonging my life. And so having those really hard conversations, but very clear, so there's no confusion about, I want IVs, I want CPR, I want a ventilator, etc., are really helpful. And when do you want them? And when maybe you wouldn't want that kind of intervention. Because really understanding what that question is and having a conversation with your surrogate, whoever's going to make those decisions for you when you're not able to speak for yourself, is really important. And I
Now
don't think you don't think you have to be getting up in years or having many birthdays to have those conversations. It makes it, God forbid, somebody has an accident as a young person, at least having the conversations where it's really clear makes the tragedy of the situation a tiny bit easier.
So a do not resuscitate. Is that something that people should be thinking seriously about? And under what conditions might you want to have that?
So there's levels of advanced care planning. There can be comfort care. So I have a condition of which I'm not going to get better. Alzheimer's or dementia would be a great example. And before I developed those symptoms and couldn't articulate my desires, I had a conversation with my family or surrogate about what I would want. And everybody wants and deserves to be kept comfortable and to be kept clean. When you sign a do not resuscitation order, it doesn't mean that you won't be kept clean and comfortable. It's simply, do you want CPR? Do you want medical only in terms of medications to stimulate your heart? Or do you want to slip away because you have an advanced dementia and you're not going to come back to your health state? Making those kind of decisions are really important. I will tell you quite candidly, most of us in healthcare who've worked on the resuscitation teams are pretty clear about what we want and what we don't want. And in those situations, and unfortunately, other than TV, which often dramatizes and totally misrepresents the situation, the average person who's not in healthcare doesn't really know what those questions are. So, and what those decisions really entail. So having the conversation and the guide to go through it, the process, maybe you don't know exactly what you want, and it'll help you consider and maybe make those decisions if you're ready to.
Right, and that's where the guy she's referring to is this one, as well as our other guide called Planning for My Future, which we're going to go through in just a moment. And those two guides will bring forward the thoughts, and it'll spur that discussion that you need to have with yourself. Not only with yourself, but then you need to expand that to your partner or your spouse, and then your children, if you have them, family members, sisters, siblings, neighbors, or friends, or Grangers, or Masons, or whomever that you feel comfortable with to share your desires. Phil, if we could go back now to the top of the webpage. And we want to go to the very last tab, which is called Videos. And this, for all of you, is very valuable. Everything is in one spot. Not only videos, but PowerPoint slides. Here, right there is the guides. The first guide that Phil is clicking on is the one that's talking with a surgeon, preparing for surgery, or just going to the doctor. That's page 1. He'll scroll down to page 2. These are the questions that we were just talking about. What happens if something goes wrong at the surgery? Here's some questions that you want to ask that surgeon or your doctor. These questions will apply also to just going to your doctor for a regular visit. At least it'll open up ideas for you to address with your doctor, whoever you're talking to. There's spaces there for you to write additional questions or to write the answers. So that's the one guide that we've prepared for you that we hope that you will print out and give it to all your members at your Grange and share with, take it to the fair. You all are coming into fair season. You're going to be going to the 4-H fairs with your Grange table. You'll be going to the county fair, to the Farm Bureau, to the farm show with your Grange table there, displaying your food products, your crafts, your canning, your seeds, your animals, whatever. Have the brochures there. Print 500 of them. That'd be great. I bet they'll be gone before that fair is over, because people want to plan for their future, which will open up now. It's Planning for My Future guide is where you can sit down yourself and start to answer some of these things here. It's not answers, it's capturing all the data you have scattered throughout your home. I live in Florida. My son's in Virginia. My daughter and family are in New Jersey. So if something happens to me, where are my insurance policies? What, not my policies, but what insurance do I have? It's in my wallet, but what's my policy number, phone number? If you fill that out, it's very quick. Do I have long-term care? Do you have long-term care? You fill it out. Am I a veteran? What's my veteran number if I go to a VA hospital? It asks for your blood type. You all should know your blood type. That's important. You need an emergency transfusion. You can't answer the question. Who's going to know that? Not good to get the wrong blood. What pharmacy do you use? Legal. Who's your lawyer, your attorney? Where's your money? What bank? You can fill in the location, your point of contact. It's up to you how much data you want to give to your family members or your neighbor. It talks about, then it starts asking you, if I have a life-threatening complication, which Dr. Ferguson was talking about, do I want my life prolonged forever? Or do I want comfort care only? So these questions and this planning for your future will not only give others information, but it's going to make you think. It's really going to make you think. And then on the back, We put a place where you can list all your medications, one spot. And it's recommended that something like this be put on the side of your refrigerator. EMTs, first aid, fire departments are instructed. I was an EMT in my younger days. You go in, you look on the side of the refrigerator and see if is there of this type of information, or at least a list of your drugs. You don't want to go and mix up drugs because the doctors don't know what you're taking. If you end up in a hospital and your doctor isn't a member of that hospital, or if he is and he's not available, this will be a great value to your caregivers. What else is on this site? We have a reporting form. You as Grangers are lucky. Every Grange, well, I should say, got on the stick this report form. Phil is showing it to you. We hope that you'll fill it out in May of 24, October, and May of 25. If you fill it out and provide us, what you did, the date you did it, how many people were there, and it could be is that I printed 50 copies and I put it at the YMCA of the guides. All right, just tell us everything you're doing. Because remember, we're going to get paid based on disseminating this information across this nation. So we need, the National Grange needs your help. We need the reports right here. It's already there, simple. If for every subordinate Grange, we provided you a list of 5 ideas that you could do. One is doing a program at your Grange, do a program for a neighboring organization, to make a display and have these things at the county fair, advertise. And Phil prepared for you all recently in every state Grange newspaper, there's going to be an announcement to remind you all about this program. Here's a flyer that's already done for you. It's on the website. You could pull it up and say at Acme Grange on Highway 1 in Oshkosh on next Thursday at 8 o'clock. We're going to do a program on these topics. Are you a senior citizen? Do you have questions for preparing for surgery? Come to the meeting. It's free. So you don't even have to prepare a flyer. All you have to do is fill out this information. And then we'll go on down on the website. Here's some briefings. You don't even have to prepare a briefing. Take the ones and change the cover page, put your name on it, and use the material that's already there. You don't even have to do that. Now we come to all of the rest of this. Here's all these quips that you can, if you see Dr. Ferguson's everywhere, you see Granger's, and you can play one of those little clips. And if you take your computer, turn the volume up and play it, it will give you the lead in for discussions. Things that Granges will start talking about. Whole segment on hospitalization, preventing falls. Now, what else have we done? These dark blue boxes, there's 5 of them. Hospitalizations, the dangers of falls, is a lesson. We call it a little workshop. It's 6 minutes. They're all between 5 and 6 minutes long. And they will set the scene for talking on that particular topic. The dangers of falls for seniors. And in that little blurb there, that lesson, are quotes from the doctors, quotes from some Grangers, ideas. We got a little lady in Colorado to pretend that she was on a walker. She's not, but she pretended she was on a walker. And she had a problem trying to get up a set of stairs with that walker in her hands. How do you do that? Well, those are things you need to think about. How do you prepare your home? Do you need to think down the road, do I need a ramp? So let's go a little farther, talking to others. These are everybody's ideas on how to help you. I'll call it sell this program to others. you Grangers that are out there, you need to sell it to others. Tell them how important this stuff is. Talking to others, preparing your house, advocating, etc. So all that material is there that you could utilize for your Grange program. So it's this is a very important topic for every one of us, not just seniors, but all of us need to think ahead. I'm a senior, certainly, but Stephanie Wilkins isn't a senior. She's got teenagers, and now she has had to think ahead on how to care for her parents, what to do. You have to talk to others. Let's go back up to the falls tab. That'll be the last one because I want to tell you all how this is important for your youth and your juniors. You know, we talk a lot about seniors, but if we go to falls, some of you, many of your Granges, you have a youth group or you have juniors. And we did this at National Grange. First, we walked through a little bit of this with the junior Grangers. And then I had all the junior Grangers fall on the floor and they were laughing, carrying on, because I said, suppose you came home from school and you found your grandmother on the floor. And so they all pretended they were grandma. So then we did, you need to talk with them while you're dialing 911, but have them do a little self-assessment. And so there's parts of this narrative down below that talk about how to do a self-assessment right in through here. You know, like checking for your wrist. Can you move your wrist a little bit? Can you wiggle your toes? So that, you know, you and I, when we fall, the first thing we want to do is what? Jump up. We're so embarrassed to death. Who saw me? You're looking around. Who saw me? Oh my goodness, they saw me fall. I'm a clumsy old dope, you know, and you're all embarrassed. Well, that's probably not the best thing. We should determine if we get up, if we're going to injure ourselves more seriously. So Dr. Ferguson has done quite a little bit here on falls. She has a big concern over it. And on her little clips here, she talks all about it. And we go on down here and what causes falls, things that you maybe don't think about. That throw rug you have in front of your kitchen sink. Not a good idea. Maybe it needs to be a rubber mat instead. So just things that we all need to think about. So this is a whole program in and of itself on falls that you can involve the juniors in your Grange or the 4-H kids or the youth program to get involved by thinking about how they can help their parents, how they can help their grandparents, the neighbor, if they see somebody fall. It's very important. Dr. Ferguson, would you like to talk a little bit more about falls?
Yeah, I think the reason we emphasize falls is that really it is one of the significant factors that can cause you not to be able to live independently. So preventing falls is so important so you can prevent and so you can live independently for as long as possible. But the other thing, to go back to the young Grangers, part of what we all need to do in fall prevention is to keep our core strength up and to do things that we maintain when we're younger so that as we age, we continue. But I'd also like to underscore, besides the hazards in your home that can put you at risk for falls, the other thing to do is actually do fall prevention either with a physical therapist, or sometimes that can be a class that's offered at the Grange or through some other community organization, but also working on improving your core. Can you stand up and put your underwear on without sitting down? And most people can't, because if you don't practice that all your life, you lose your balance. And so trying to regain that core strength. So I'm not proposing people go out and do that. But I'm talking about being able to stand on one foot like a flamingo is a good thing in terms of getting that core strength. So having prevention by maintaining that throughout your life, even when you're starting with young, but also if you've got a little bit of core weakness, that you go and you really do exercises to help improve that. That is one of the best things you can do to prevent falls.
Are there a couple of key exercises that we all should do for those of us that are already over 65, let's say? Is there a couple of key ones that you would recommend, or is
I
it too
think
late?
no, it's not too late. I would underscore that. I think it would be a bit dangerous to give a generalized exercises, but really I would strongly support going to an expert or attending classes where they talk about working on your core, and how you can do that to improve that. I can't uh, I enthusiastically support seeing a physical therapist or a trainer, occupational therapist, or some kind of fall prevention that works on core. There are balance programs, as well as fall prevention, and taking advantage of that before you have the fall is really important.
Well, I think that's a great idea for Grangers, that in your Grange Hall or wherever you may meet, whether it's in a church or a firehouse, um, you can invite in probably a local trainer from the gym or the Planet Fitness or whatever they are, or even a gym teacher from the high school or grammar school to come in and supplement your program here on rural health, and have them come in and maybe demo a couple of chair chair activities while you're sitting down that you could do, or on your sofa, or holding on to the back of a chair and doing some specific exercise. That would enhance your program on the category called falls. How to improve your core capability, make you stronger, whether you're sitting, doing those exercises or those core strengthening, instead of calling them exercises, core strengthening opportunities, to make it sound like it's not exercise perhaps, or leaning on the back of your dining room chair and as a secure foundation for doing some of that. But that's another thing I hadn't thought about, enhancing your program by inviting in somebody from the gym, because they'd be glad to do that, because they probably will get some business. And the school teacher is a member of your community. They live with you every day. You see them in the shopping center, they probably come in and do the same thing. Or the PT, the physical ed teacher from the high school, might be able to put together a 5 or 10-minute little routine for all of you. So that's a great opportunity to open this up to the community and get them involved as you share this program in your community. Phil, could we go to the top, please? Just for top of the website. So I haven't seen any more questions come in. Oh, there's one. The question is, the cost to have these brochures printed at print shop can be prohibitive for some of the smaller Granges. For example, 500 copies of the trifold is approximately $230. Even printing at home has an associated cost of the quality of the paper and the colored ink. The planning for your future brochure is very costly to print. Any suggestions if these Granges want to participate in the distribution of the brochures but have limited funds? Yes, I have some answers for you. I've gotten that question several times, that you want to have multiple copies printed and it's expensive. On the website, under videos, we have provided to you 2 sets of printing capabilities for each of the guides. The guide, when we go down,
it's not on the website. It's only on the flash drive.
stick. Okay. On the flash drive, there's 2 versions of the guides. One is a intense color and high resolution, which if you had the funds and you really wanted to do glossies or things like we provided to you, that you would take to Kinko's or, oh, I guess Kinko's out of business, FedEx or Office Depot or something. That's there. We also have one that we titled Print at Home. It's not color intensive. It's lighter resolution. So it is cheaper to print because it doesn't use as much ink. That's one choice. The other thing is if you have an IRS and you are 501c5, 501c10 Grange, you're a corporation from the IRS, most Office and Staples and those type of nationwide printing houses will do it much cheaper and at as a charitable, they write it off as a charitable contribution at their corporate headquarters. You have to ask them to do that, and they will print them for you at a much cheaper rate. So I recommend that you do that to save yourselves a lot of money. It is expensive. Yes, Doc.
When we were developing the guides, the health literacy principles and sort of visualizations really generated the color. It wasn't an advertising kind of campaign. There was a purpose for the colors that were chosen. That doesn't mean that that makes it the only way. I think if you print in black and white or grayscale,
Right.
it's important to get the information out. So that you know, you don't have to do it in a pretty sense.
Right. So look at the stick where it says print at home. And that is the less color, less resolution, or no color solution to save you money. And it'll still get picked up at that county fair, at that 4-H fair, in the barn, in the animal barn. If you have it there, they're going to disappear. Just keep a record of how many you did and make sure you turn that into the website or into the address at the bottom of this website, the rrss at grange.org, so we can turn it into our funder. All right.
Joan, there was another
question.
question that came in
Okay.
that says, does a Grange have to report in multiple periods to be eligible for the incentive, or can the requirements be met in one reporting period?
Great question. So along the 250 community Granges, you're going to get $100 if you turn in that report. If the first 250 Granges that bring in a report, if you do it all right now, if you've done it already, that's great. In the latest version, or 2 versions ago, with the patrons chain, we provided the link to the report forms also, and to the 2 pages of what's, you know, these are some ideas. You have to do 3, a minimum of 3 things, and provide the report, and you'll be on the list to get the $100 payment. And you can do it now. You can continue to add and send another report in October. It's the first 250 Granges that report and have done 3 things that will get paid. So the earlier the better. Okay. Oh, wonderful. Thank you. Community Granges, to get a first 250 of you that conduct a Grange program, and we have to know the number, what the program was, the date, and the number that were present. A public forum or a program, same thing. Provide the video or the guides to 3 other organizations. Give you some ideas, but all of you have more ideas than I have. Have a display at your fair, maybe in your town hall. We had a state Grange that did a display at the convention for the West Virginia Conservation Convention. They had it there, and they had 350 brochures, guides disappear. That went away to the people that attended that. Provide info on social media, you know, your Facebook page, local media, TV, radio, newsprint. Just provide a screenshot of that, attach it to your report. And then provide semi-annual totals of the people influence report. That's this report that we showed you earlier. And be one of the first 250, you get $100 check. We're going to issue all the checks right after, well, at convention time in November. By the time they all get written and get mailed to you, you should have them, you know, by Christmas. But that's the goal because you have an October report timeframe. Other questions? Any questions on that? State Granges, same criteria, but you get $500 because you got to advertise to the whole state. You have to do something that's bigger than your local senior center. Pennsylvania is about ready to get their $500 because they did their farm show, which had 430,000 attendees. They're doing it at their family festival in July, and they did another state event already. I think they're about done.
Yeah, Joe,
And
I
they'll
don't have
get
a
500.
question. I do just want to say that I think one of the things I've been hearing from Granges as we've been working on this is that it seems like there's an awful lot in this program, which is intentional because it can be more than one program for your Grange. I think some people think that they need to cover everything in one meeting or that they only have one meeting to go over everything. And I think the point is that you can make, I mean, out of the lessons alone that are on that video page, you can make 6 different lecturers programs out of that. The way that I did it at my local Grange is that there's a 23-minute version of the video that's available on the flash drive and on the website. I showed that whole video, and then we had a discussion using the Planning for My Future guide as the kickoff point for the discussion, to say, how can we move forward? What questions do you need to ask, or what questions aren't included on here that we could ask in the future too? And it led to a really fruitful conversation that we were able to have among one another. And, you know, it got uncomfortable because people were sharing their personal experiences with somebody had just come out of surgery, you know, a couple weeks before this meeting, and said, I wish I had some of this information and some of these questions beforehand. So it is a great program, and we are still adding things to it too as we go and we get feedback from these Granges. I think it's important to let everybody know that we are learning too as we do this program, and we will continue enhancing the website. We'll continue shooting some more videos, and keep things fresh and updated for everyone.
And that's important that, you know, it's moving forward. I mean, we're very proud. PBS, Public Broadcast Station, we've contacted them about doing a whole show just on this program using our videos. So the Rocky Mountain region, PBS, has accepted our 23-minute video. We have to add 4 minutes or 3 minutes of content. We're a little short. They want it lengthened a little bit. So Dr. Ferguson is going to have to go to work again, or whatever we decide to enhance this. And they're going to publish it. And now the national PBS has contacted us, and we've just filled out 6-page form that they're going to pick it up. We hope after they read all this and review our video. And of course, they want the 26-minute one. So we'll have to, you know, revise that a little bit. But that's great publicity for the Grange, for the program, to get this information out to rural America, to utilize. Yes, thank you, Phil, for pointing out every one of those tabs on that web sheet, web page is a program. There's at least 12 programs that we provided to you, ready-made. You don't have to do anything, Grangers. It's a program that you can take anywhere and share with your Grangers and community, your family. Show it to your family at home. If you want to open up that discussion on talking to others, show this little video. Show the discussion under there where Dr. Ferguson talks about how important it is to talk with your family members and to be advocating for each other. And that will open that conversation up. It's not easy. As Phil said, it's not easy. Dr. Ferguson, what would you like to say here as we close up?
No, I think Phil made a good point, breaking it down, partly also because the content becomes pretty heavy, and sort of taking it in pieces and sort of chewing on it, I think makes it a little more manageable, and more worthwhile.
Great. Well, we'd like to thank you very much for joining us this evening and sharing your expertise. And not only this evening, but throughout this whole process. It's been about a year. We won this contract on June the 1st. So we wanted to kick off our second, it's a 2-year effort. So we're just starting our second year now of the contract. However, we were able to put all the material together and really start the campaign at National Grange session. That was our goal. Once we knew we had the contract, we had to build it all. And it took us until, October to finalize the last things with the help of everybody we talked about in the beginning, our stakeholders and the regional folks and the doctors to do the videos. And then we kicked it off in November. So we've been at it now for 6 months. You've been at it for 6 months out there. And we're looking forward to the next 1 year that you all are busily sharing this with your neighbors, your friends, and your family. So thank you for joining us. Thank you, everybody that's worked on it to date. We look forward to it. Send us any questions you have. We're there to help you, and we're there to come and help you if you need help on the ground. Hopefully we can talk you through anything that you need. There's the contact information. Phil is so good. He just put it up. The email address is up on the website, rrss, that's Reaching Rural Surgical Seniors at grange.org, and we'll get right back to you with whatever you need. Any closing remarks? Any
I wanna
closing
say
questions?
Thank you to everyone for being here. Joyce and or Marty Bilquist, I don't know which one's using their Zoom tonight, did make a really great point to say, if you're doing, I figured it was you, Joyce. If you're doing the planning for my future brochure, just make sure your family knows where to find that information, the medical power of attorney, that kind of stuff. So have that conversation, because you never know when they might need to access it. And it's really important to also update that regularly, that it can't just be a one and done and stick it in a drawer, that it does need to be looked at every once in a while and make sure things are up to date on it. So that's why
And
it's
we have
also
another
available to download.
We have another question, says, should we contact our local PBS station? If you would like to do that and ask them that you heard about this program and you'd be interested to have them bring it forward and as one of their documentaries, that would be helpful for us as we try to get it captured by the nationwide by PBS. So it would help us in the long run. They won't have it yet, but they certainly could put a bug in their leadership that they're looking forward to seeing. I don't see any other questions. It was Joyce in Montana, Vice Marty, it looks like. Anything else from anyone? Thank you all so much for joining us tonight. Dr. Ferguson, thank you so much for the effort that you've put into sharing this vital information with rural America. We really appreciate it. And good luck to you there at the college with your professorship. And I guess your year is ended and they've all graduated, and we have new nurses out there that hopefully will service some of you on the line. Maybe they'll end up in your local community. So thank you for what you do for a living. We appreciate your work with us. Thank you all. Have a good night, everybody.
Have a great week.
Bye-bye.